I'm Beth Perrell speaking to Marni Stahlman, President and CEO of Shepherd's Hope. They are offering free back-to-school physicals for children. Marni's here to let us know when and where. Thanks for joining us, Marni.
Well, thanks for having us back. It's always a delight to be able to join you and your listeners and also educate them on some of the services that we're having available here at Shepherd's Hope.
So one timely issue is that you're offering these free back-to-school physicals for children, several scheduled dates. So I'd like you to let us know about that. And these are the physicals that the children need to have in order to get the form to enter public school, correct?
Exactly. And, for a lot of our parents out there that are listening and families, they're familiar with this because they may have children that have already been enrolled in a public school. But, Beth, we have a lot of folks that come into the community here in Central Florida that may not be familiar with some of the rules that Florida has about enrollment for public schools. And you're correct. There are two Florida Department of Health required forms that are necessary for children to be enrolled into the public school, that regardless of what county they're going to be in. And part of the process that we have is obviously for children that are uninsured and don't have a primary care pediatrician or medical home. It's very difficult for them to obtain those forms and get them in place so that they can roll and start their new year school off on a good foot. So we're going to be offering and expanding our locations this year. It's our fourth in partnerships with Nemours Children's Hospital. And this year we're going to be offering them at our Longwood location, which is on 600 North U.S. Highway 1792 in Longwood. We're also going to be offering it in downtown Orlando, which is a new location we've added this year, and that'll take place at the Orange County Medical Clinic at 101 Southwest Moreland Drive. And then our third location will be at our Dr. Diebel Jr. Memorial Health Center, which is on our east side of town, and that's going to be located at 9833 East Colonial Drive. All of these locations do require an appointment because there are different times for each of them, and we do want to make sure that we're getting all the families with kids into a spot. And so we're asking that they call the information and schedule that appointment, and they can call 876-6699, extension 221. And our person that answers our phone, we call her our voice of Shepherd's Hope, Relis, will be able to take the information and look at what available slots are available at any one of those three locations. An important note, Beth, for your listeners is they don't have to be a resident in any of the two counties or three counties. So, for example, if they want to come to the Longwood location, they can be a resident in Orange County, Osceola County, Polk County, Lake County. That's just our location, even though it's located in Seminole. So we have the forms, and they're universal, the Department of Health, regardless of what county. So I don't want our community out there to think that one location is required over another. We really want them to try to find the one that's best for them on the best date and at the best time.
So I know that when somebody calls to set that appointment, they're going to get this information, but I'm just curious, do parents need to come in with any kind of shot records and such that they already have?
It's helpful if they do have it, but we'll have availability to be connected to something called Florida Shots, which is the state repository, and it keeps track of other shots that the child may have had, regardless of where they may have received it, because they are required to be registered.
And then the other thing to emphasize here is that idea that for this, they need the appointments.
Yes, and as you know, Shepherd's Hope traditionally does not require our patients to come for an appointment at any one of our locations. But because we are expecting and have already seen a large number of people calling, we are trying to schedule them as appointments so that we can make sure that we have enough staff and team members available to accommodate whoever might be coming. And this year we're offering something in addition to the screenings for the children at our Longwood location. We'll also have the mobile mammography bus from Florida Hospital on site. And so while their children are off getting their physical and update, moms can go and get a screening mammogram, which is very important, as you know.
And you did that last year as well, didn't you, at one
We
location?
did. We did, and we had a lot of success, and we're bringing that back, and we're very pleased to be partnering with Florida Hospital for that particular portion with their women's mobile wellness coach, so that we also bring forward women's care issues. Because as you know, as a mom like me, sometimes we put our needs and our healthcare concerns second to our kids, and those mammogram screenings are really important. And they're at no charge when they come to the clinic. So when they are calling to make the appointment, if they want to get a mammogram screening as well, please let the person that they're speaking with know, and so that they can have those available. And again, those are only going to be available at our Longwood location, because the mobile wellness coach needs the space to navigate in a fairly large parking area, and our other two locations just don't accommodate that.
Now, just to reinforce the idea of calling in for the appointment, the mom is able to schedule that at a similar time to when the child is getting, the
Yes,
checkup.
that's the idea. So that while the patient child is getting their physical, mom is up on that bus getting her screening.
And also, if I have multiple children, I can coordinate them at the same time as well?
We would prefer it, because we want to make sure some of our moms and dads and parents out there have difficulties with their schedules, and they have difficulties with transportation. So yes, absolutely, if there are multiple children, please have them come. And they don't necessarily just need to be children that are public school age. We see children as young as infants, and if they have them and they haven't seen a physician or had a checkup in a while, please let us know that, and we can schedule that to take place at the same time.
But what are the guidelines as far as you really need this done in order to register for school? Is it certain grade levels?
It's anyone that's enrolling in a public school in the state of Florida, so that starts with VPK in kindergarten age and goes all the way up through graduation. And it also applies, interestingly enough, to anybody that's interested in playing sports in a public school. They need that special sports physical form, and we have those available as well. We know we have lots of kids out there that are interested in soccer and football and swimming and volleyball and lacrosse and all of the other wonderful activities that our public schools help to support through their initiatives. And they do need that as part of the Florida Association of Athletics to get that sports physical completed as well.
Now, is that a standard form? Because I know some schools have their own form, but is there like one universal form you can give them to use for sports?
The DOH form is usually pretty universally accepted. And if they're not, we can download one from any of the particular schools. I know we have multiple counties here, and as you pointed out, some do have something unique. But the Florida Association of Athletics has a specific form, I believe, and that's the one that will be used.
Now, other than the sports, it's more about being able to enroll in the school, or even for students who are returning and maybe
Correct.
just need to show they have the latest vaccination.
Yes, and that's a great distinction. It's not just for new students, it's for returning students. This has to happen every year. So my daughter, who will be enrolling at Audubon Elementary again for fourth grade, is going to have to present these to make sure that her enrollment is kept current for what the Orange County Public Schools need.
All right. So again, different dates throughout the month of July. Actually, how many weeks do you have this underway?
We're going to be running it from July 31st to August 10th. So our Longwood location will have on July 31st, August 3rd, and August 9th. And those will be morning appointments, because we know moms and dads and parents out there need to manage both evening and mornings depending on when they're working. So the Longwood location is going to be offering their appointments from 9 to noon on those 3 dates, the 31st of July, August 3rd, and again August 9th. At our downtown clinic on Westmoreland, it's going to be offered on Wednesday, August 2nd from 6 to 9 p.m. And in our East Orlando location at the Dr. Diebel Memorial Center, it'll be August 1st and August 10th, also from 6 to 9 p.m. And also I will add, Beth, that we know that sometimes parents may not be able to fit in within these parameters, and we do offer physicians to see children, not too often, but fairly usual at our regular locations if a parent needs it and isn't able to come during one of these dates. We will try to see if we can squeeze them in and get that child this important physical, because we know it's critical for them to get to school.
Okay, so 407-876-6699 is the number to call now to start setting up those appointments.
And that's the extension 221, and that takes you to our main administrative operator, and she can connect you with each of the 3 locations and which one you're interested in.
All right, I am speaking to Marni Stahlman with Shepherd's Hope. We're talking about the free back-to-school physicals for children. Marni, we'll go ahead and remind people again in a moment, but I've got to pick your brain. Let's talk about what Shepherd's Hope does day to day and how that is impacted by, well, the latest debate about the Senate health care bill. So why don't we begin with what you do there at Shepherd's Hope?
Well, Shepherd's Hope, as you know, our mission is very clear. We provide access to health care for the uninsured and underinsured here in the Central Florida community. And it really is a free service. There are no costs associated with coming to a Shepherd's Hope location for primary or what we call secondary specialty care. Many of our patients, as we've talked about in the past, will present with something that we consider an acute illness or difficulty. They may have a respiratory infection or some sort of other emerging thing that they have come to the clinic to have looked after. But when we see them for follow-up or we get into their history, we find that there are chronic diseases or disorders that are also present: diabetes, high blood pressure, obesity, sometimes even cancer. And so we provide not just that primary visit, but specialists at our clinic at Well and out in the community that are available to work with our patients and attempt to try to get them hope and healing, regardless of their ability to afford that care. And we do that supported by the network of our 3 hospital partners: Nemours Children's for pediatrics, Florida Hospital, and of course Orlando Health. And among them, they provide nearly 450 active volunteer nurses and physicians that come to our clinics to provide that care on any given day at 4 or 5 locations across Orange and Seminole County. So last year, we provided nearly 17,000 patient visits. And unfortunately, we're tracking up from what we saw prior year in our first quarter, January through March, and now just concluding our second quarter of April through June. And it's entirely related to the concerns and anxieties that folks have about the state of healthcare and coverage for healthcare services that are currently going on. So we certainly continue to see a large amount of patients presenting at Shepherd's Hope without the ability to afford health insurance or be available to qualify for the subsidies for the healthcare exchange that will help them offset what the premium costs might be.
So long story short, you're busy. And all of this discussion about healthcare is really something that you feel maybe before other organizations.
We're seeing it now, absolutely, and we're grateful to be able to be here, but we are stretched at our capacity demands and are really grappling with recruiting more volunteer clinicians is always a priority. So if there's someone out there that's a nurse or a physician or physician's assistant or CNA or LPN, any of our qualified healthcare professionals out in our community, please call our number at 407-876-6699, and extension 221 also will get you to our person that will help you navigate to our volunteer program manager. We are in serious need of more volunteers to help offset the number of patients that we see presenting every night at Shepherd's Hope. So yes, you're absolutely correct. We're seeing the increase probably before the calm before the storm.
Well, why don't we go ahead and hear your observations then? We've had you on the show before, kind of sharing as different points come out. What are you seeing right now that you would like to tell our legislators in Tallahassee, that you would like to tell the Senate as they consider their new health care bill, and frankly, that you'd just like us in the community to know about health care and the conditions?
Well, if we have some of our state legislators and our federal legislators listening in or paying attention, we want them to fight to maintain the access to affordable care that is currently in place. some of the information that has come out just in the last 24 hours, as many people may be already aware and hearing about it, is that the proposed bill to change and now is being referred to as the Better Care Reconciliation Act, which will change the Affordable Care Act already in place, is indicating that anywhere from 20 to 22 million people will find themselves who currently have insurance not able to continue. And that is going to significantly affect the number of people that are going to be inputting at Shepherd's Hope. We've seen already some information out that from the CBO office indicating that the biggest increases for people that are going to be affected are going to be those ages between 55 and 64 years of age, and individuals with incomes under 200% of the federal poverty guidelines, which are our patient population. So we're certainly right in the sweet spot. And what we want our legislators to know is please don't change the access to care that was currently in place or change the ability for individuals to afford the subsidies and receive them so that they can accept the premiums and the copays and deductibles, which are right now crippling what's available.
When you consider specifics, whether it be, in the Senate bill or anything we have underway in Florida, is there something specific you could speak to in that access?
Well, we're already hearing, and what we're attempting to do is to get some of our important and critical patient stories, the stories of patients that may have been here at Shepherd's Hope, but because of being able to now qualify for the subsidy and receive insurance, have been able to have their cancer treated and have survived, or have had a critical operation. We have countless numbers of stories as we work as a part of the Primary Care Access Network, or PCAN, in Orange County, with navigators to help individuals that present at Shepherd's Hope without insurance to see if they in fact do qualify. And we've had great success with getting patients that previously have come to us without any options being able to now find some that gets them insurance coverage. And in some cases, more often than not, it's life-saving. And when we go back and talk about children, certainly in the back-to-school physicals, which we started with today talking about, children are right there in the middle of that. And they're the unwitting victims, if you will, of being caught in this push and pull back and forth of what everyone feels is best. Shepherd's Hope's position has and will continue to be that we are the voice of the uninsured, Beth, and we believe that everybody has and deserves the right to access to health care services.
Tell us a little bit more about this concept of underinsured. How does that lead to people coming to your doors?
Well, underinsured is where what is affectionately known as the coverage gap. Those individuals that find that they have an insurance policy, but they may be able to afford the premium, but they find that they have a copay and a deductible that are thousands of dollars, which would then make the policy not tenable to use. And that's what commonly is the definition of underinsured. Because while they have the policy, they can't actually utilize it because the co-payments and deductibles may be in the thousands of dollars, which they don't have access to, and so the individual winds up not using it at all.
So they're paying for insurance, but they're not able to actually use it.
Yes, and I had an individual say to me not too long ago, it's like having a Lamborghini without any gas.
Oh, interesting analogy.
Mm-hmm. Because for his individual case, it was the first time that he actually had health insurance, but the subsidy was able to afford or offset the cost for the premium, making it manageable and affordable. But when he went to access it to use for copay, he might have a $60 office visit, and he might have a $5,000 or $6,000 deductible, which he has to reach before insurance will start to kick in and offset his costs. And that's no dollar that he has in his pocket.
So now back to the children. So a family may have insurance, but it's still tough to get the child over there to take care of the flu or something like that?
Yeah, because they may find that they're underinsured and that copay and deductible is just too much out of reach. What many people don't realize also is that there's a separate program that we have here in Florida called Florida Kidcare. And children can be enrolled in Florida Kidcare regardless of their parents' income and status and get individual coverage through that through the state of Florida for some of the issues and health concerns that children have. So that's also available at Kidcare, and that can be easily looked up through the state of Florida. And that's also something that we work with children that present here at Shepherd's Hope every day to try to work with them and help navigate them so that those children can get enrolled.
Now, you've said to me in the past that what you offer is not ongoing care. This is not, to become somebody's family doctor.
Medical home. Yes, we're not a medical home. We're not a place that you can continue to come back to, not because we don't want to, but because our physicians, our clinical staff, they turn over every night. There's someone new here. So we don't have that continuity as a place for you to continue to come back month after month, year after year. We really work with the patients and their families to try to find that medical home through our community health center partners, Grace Medical, True Health, Central Florida Community, Orange Blossom are all federally qualified health centers that can take these patients and bring them in with a medical home. And we're working closely with them every day with their care team coordinators to find these spaces, but they're limited, and we have a great need and not enough spots.
But the value, isn't it, of having that same doctor who's watched the child progress through the last few years? They're able to catch the nuance and maybe prevent some issues that could develop?
Absolutely. My daughter has been very fortunate, and she has a medical home, and that physician has been guiding her since she was an infant, and now she's 9.5. And you're absolutely right. The nuances of understanding someone that you see time after time, and even for adults, not just children, adults that have chronic conditions like diabetes and high blood pressure, it's really important that those clinical team working with the patient understands some of the other aspects of their life so that they can get updates and understand what are the pressure points and things that might be affecting not just their physical health, but their emotional well-being as well.
Do you have any positive things you see happening right now, and whether it be with Senate bill or any kind of healthcare legislation going down?
Well, I don't see anything positively at a federal level, but here in the state of Florida, Shepherd's Hope is a member of the Florida Association of Free and Charitable Clinics, along with 90 other free clinics across the state. And we were very fortunate that our legislators in Tallahassee were able to allocate a small amount of dollars that will come through the state association as grant opportunities to clinics like Shepherd's Hope to help offset equipment purchase costs, prescription costs, medical provider costs, all of the things that go into some of the operations daily that take place at any one of our clinics. And we're hoping for those dollars to start to be available on July 1st, which is obviously just around the corner. So there's a very large bright spot there, and this is the second year that the legislature has continued those dollars appropriating into the Florida Association of Free and Charitable Clinics, and we're very grateful. We had some champions right here in Central Florida. Representative Jason Broder was one of them, along with Senator David Simmons, who we're also very grateful for making sure that the governor and their legislative colleagues understood the importance of the clinics like Shepherd's Hope and the impact we make. The other big bright spot that we have here that I want to make sure our community knows about is our hospital partners. Florida Hospital, Orlando Health, and Nemours help a great deal with helping to have their clinical team members serve as active volunteers in our clinics every night, and without them we would not be able to operate. And then, of course, they're there for us as well when we have that critically important referral for someone that needs an expensive medical test like an MRI or even cancer treatment or surgery. And those hospital partners have stepped up time and time again, and they often are not given the credit that they so richly deserve for being just true heart. Last year, they combined almost a complete in-kind value back to Shepherd's Hope for those hospital services of nearly $17 million. And that's something that I don't think a lot of people are aware of. So we're very fortunate here in Central Florida that we have that happening for us. But as we've talked about today, Beth, we're seeing an incredible influx, and we're a transitory community with lots of people coming and going, and they need help with their health And Shepherd's Hope is committed to being here, but we're strapped. We need volunteers. We need more financial support. We need these individuals in the communities and businesses to understand that without what we do here, these are individuals that possibly would not be returning back to work or being able to support their family and pressing in on other social service needs and providers that are here in our community. So everyone is going to feel the squeeze of this.
Okay. Well, I'll tell you what, let's take a couple of minutes to return to the other great thing you have underway, which is the opportunity for parents to take their children in for free back-to-school physicals.
Yeah, so let's recap that again. Starting on Monday, July 31st through August 10th at 3 locations at Shepherd's Hope, and these are available with information on our website, Beth, at shepherdshope.org. So that's www.shepherdshope.org, and you can find the information on our dates and our times and locations right there on our website. We also have the information available by phone if you'd like to call in at 407-876-6699, extension 221, and the person answering can get you to the location that you might be interested in and the times that those clinics will be available and open for the children to come down. And moms, don't forget about the screening mammography option that will be available at the Longwood location as well, so that you can get that screening mammogram.
All right, Marni Stahlman, some great information. Anything you want to drive home? Any final thoughts for us?
I think what I'd like to just drive home and have as a final thought is we're very grateful for the support that we receive here in the community, but we're going to need more of it, Beth, as we see more and more people affected by some of the changes that are going to be happening on a federal level. And if people are interested in how to support us, they can call our main number, they can go on our website, they can reach out to me directly, and I would be happy to receive that call.
Marni Stahlman is President and CEO of Shepherd's Hope. I'm Beth Perrell.